Today's video is what I call the 5% rule. And what I want to talk to you about is, as you know, I do a lot of fat transfer for facial rejuvenation. I want to refine that concept for you. A lot of people come in and sort of want to dictate their care. They need this cheek done. Doctor, I just need this lower eyelid done. Can't you see that's the problem? And what about, how about just a drop here and that's all I want? And the problem with that is that that's not how we relate to each other. So there's a big problem of dictating the care. As an example, I had a gentleman come from another state, and he had a lot of permanent fillers in certain parts of his face, and it wasn't balanced. The cheek was larger than ideal, and I had told him that, and he wanted this there, here, and there. And I said, it's very simple. I'm an artist, and I want to make a face look good. So when you look at my before and afters, there should be a visual, compelling reason to choose me, because you can see the improvement of the result based on the beauty of the total aesthetic. A lot of times when you see before and afters, you see them at a profile view, close-up shot, fold over here. And again, that's not how we relate to each other. We relate to each other looking at each other straight on, and there should be a wow effect that fast. It should be an impact where something about you looks better, but you can't really tell what it is. So what exactly is the 5% rule? The 5% rule, in my opinion, is to put a little bit of volume in all the right places to make the face look good. Sometimes we're overly fixated on one area. And so in my opinion, if you just make a large cheek or just blow up the brow or just fill the chin, it looks weird. Something is not quite right. So a lot of people come in, they say, can't you just do part of my face? Now, if you're very young and there's only very limited areas that need to be worked on, it makes sense. But in the majority of patients, especially those that are past 35 into 40, they don't even know what they want. And the reason they don't know what they want is that there's a couple reasons. One is that they're very focused on the wrong things. For example, we've been indoctrinated to think, hey, the folds and these folds need to be fixed, I got a bag needs to be fixed. So all the standard vocabulary out there is used to tell me, hey doc, I need these three areas fixed. But the problem, if I talk about anterior chin depression, you go, what the heck is that? And you think, well, is he talking about the folds? Is he talking about the jowl? Maybe he's talking about that. No, I'm not talking about that at all. And if he says, you know, but my skin is hanging, doc, you don't get that. It's heavy. And I talk about filling the outer brow to change the eyelid shape and soften it in case there's a bad surgery. You don't know what I'm talking about. Or, you know, and all these things are really hard to articulate until you sit down and talk with me. But the 5% rule means, hey, if I can just make this little area 5% of the equation of improvement, so I don't make a big brow, but improve it a little bit here, and I improve the tear trough, I improve the lower eyelid, I improve the anterior cheek, I improve the outer cheek, I improve the lateral buccal transition zone, the central buccal transition zone, the medial buccal hollow. Most of the words you don't even know about. If you're very gaunt, I rebuild the outer mandible. I rebuild the transition from the mandible into the buccal zone. I rebuild the pre-jowl area. I rebuild the anterior chin. All these little areas are equal to, let's say, 5 or 10%, and when you add them all together, you get a cumulative wow effect. Because if you think about it, we don't age by just having a bag. We don't age just by having a fold. We don't age by just having a little bit of extra skin. And the problem of micromanaging the face in that regard is that we tend to just focus on the very obvious points. There's 2 or 3 things I need fixed, doc. This is on my laundry list. You need to fill these things. And the real ultimate problem with that is several-fold. One is that you don't look better when I'm done with you. Or I make a cheek too big that's not relatively balanced to the chin, or this area doesn't fit this area. And so what I really want you to understand is when you come and pick me as a surgeon, you also pick me as an artist. And I know that sounds like it's some kind of fancy word that's used as a marketing term. And yeah, of course, you know, I want you to be convinced that what I can do is better than most in the market. But really the reason for that is looking at my before and afters. And what I'm going to do when you get into my office is I'm going to explain the 5% rule by breaking down all the little areas so you can begin to understand what constitutes that. And what I'll do as an exercise, I think it's a fun exercise, is I'm going to cover the obvious problems of the face. Let's say it's an eye bag. I'll cover the eye bag. I'm going to ask you a question, does a person look more youthful? And the answer is most likely no. Or if I'm going to cover the area you think really ages a person, and I'm going to show you that that is not the answer. Because if I take down 5% of the aging or 10% of the aging, it's not enough to reach a critical threshold for improvement. So what's really, really important is that when you come and talk to me, I want to be able to visualize your face for you and help you through a process of seeing where the areas that need to be worked on. Because a lot of things you may not understand, for example, rethinking and retooling your perception of negative space. For example, the chin. I just had a consult this morning with a gentleman from California on the phone, and he was trying to focus on the fold and the jawline, and he really didn't get the fact that what I was focusing on is anterior chin depression, and I had his old 18-year-old photograph and his photograph now at 45, And I think he can get it a lot better when you do a side-by-side comparison. Also, he was talking about maybe his brows were low, but I looked at his brows at youth, and it was actually lower. And that distance between the brow edge to the upper eyelid skin was actually narrower and fuller at 18, which is so antithetical and so difficult to understand until I sit down with you and look at those old photos with you, or at least work you through the analysis of my before and afters. You know, I think in about 15 to 20 minutes when you sit down with me and we do this analysis together, there is almost no equivocation in terms of your ability to understand what I have to offer you. So hopefully understanding that if you come in and you say, look, I just want these 3 areas filled, you really are missing the picture of what I can do for you. And that's why an in-person consultation will allow you to understand why making a big cheek is not the answer, making a big chin is not the answer, but facial balance and allowing me to get through those small 5% little areas. I call it airbrush work because essentially that's what I'm doing with fat transfer, is just airbrushing all the little defects to reunify the face that was present many years ago.